Hi, I'm Chelsea Long, and I will be talking about treating lupus. What comes to mind when you think of an incurable disease? Do you think that the worst is to come, or do you let it just run its course? Some people want to seek treatment. Approximately 1.5 million people in America have been diagnosed with lupus today. Lupus is an erratic chronic disease that is sometimes fatal. Your immune system attacks healthy tissue in your body and can cause inflammation and damage to any organ system. An incurable disease like lupus is like running a never-ending race, but it doesn't have to be. There are treatments that are beneficial to make lupus less of a burden. I will tell you about 3 effective ways of treatment that can help you live a healthy, normal life. First, conserve your energy. Second, know your medications and know which ones work for you. Third, develop a support system. The support system is beneficial to you in this great time of need. Let's begin by learning how to conserve your energy. Ann S. Uterback, who has a PhD and is a broadcast voice in Virginia, was diagnosed with lupus in 2006. She said, "When lupus hits, it's like running into a wall at 80 miles per hour. That's hard." Fatigue is one of the most common symptoms in lupus, and 81% of patients experience the symptom. You get tired and overwhelmed very easily. It isn't known what causes fatigue, but it can be from an underlying cause. So I say get more sleep. Most people need 7 to 8 hours of sleep, but lupus patients might need more. Prioritize your day. Anne also said, "Every morning I think about my day and prioritize the most important things that I'm meant to do." I would do that too. Do the important things first and leave time to rest and relax. Nap time is great time. A good way not to feel overwhelmed is always to prioritize. Now that you know your limits, let's know your medications. Medications to treat lupus. Common medications used to treat lupus are anti-inflammatory and corticosteroids. Anti-inflammatory medicines are used to reduce inflammation that lupus causes in the body. Most anti-inflammatories are NSAIDs. Examples of NSAIDs are Celebrex or Motrin. You have to try different ones with your doctor to know which one works best for your body. The main side effect of NSAID is irritation of the stomach. So just try different ones because you really need to know what medications work best with your body. Everybody is different. Acetaminophen is like Tylenol. Tylenol is the brand name, but it's just a pain reducer because lupus can be painful, but it does not reduce swelling or inflammation. Corticosteroids reduce swelling, pain, warmth, and tenderness, all caused by lupus, and it reduces your immune system's response. They regulate your system and your blood pressure. Most of them take in pill form, but you can take it in cream form around your skin or your joints. A more serious approach to lupus is immune suppressants and anti-malarials. Immune suppressants suppress your immune system so your immune system is not so overactive, but there are serious side effects to this because you are more likely to get infected with viral infections, so you really need to have everything checked out. Anti-malarials are taken in conjunction with other medications, and most of the side effects include stomach irritation and eye problems, but it takes months for this drug to build up in your system. Medications help repair your physical being, but what about your mental well-being? Support systems are great, especially during this time of need. Lupus in the family. Life will inevitably change when you're diagnosed with lupus, so your family really needs to be understanding. Chores and responsibilities will need to be redispersed throughout each member because you can't do everything now. You have limits to your body, you're more tired, you have to take a lot of medication, and you're mentally drained. It is good for everyone to be patient and tolerant with you, especially the emotional part. You will feel guilty that you can't do everything, but it is okay. You should be not a burden to your family, but everybody should pitch in to make everybody's life better, because your life is not only changed, your family life has changed. Parents and lupus. Children who get lupus in them is the same as adults, but can be a little more aggressive because children are not yet finished growing and their body's response can be a little bit different. Parents should educate themselves as much as possible about the disease and educate their children about the trials that lay ahead. Be there for your child and know their limits with their activities, and also explain why they can't do so much, and also be very tolerant with them because they're not the same anymore. Now that I've reviewed effective ways of treating lupus, we can tie them together to see how they work together. Treatments of lupus can be scary, but if you combine all of these together, you will have a better physical and mental well-being. Remember to save your energy, know your medications, and establish a support system. Just these 3 things alone can help you build a better quality of your life. This disease may be incurable, but it does not have to take over your life or define you. You can treat lupus and make your life more comfortable. I too have lupus, but just using these 3 effective treatments, I have found that my life has been more better, and I have a better quality of life, and I'm living as healthy as possible. I am living proof that these treatments are great and treating lupus is possible. Thank you.